The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions every day. And the first session of the day in Hindi is already over from 7:30 to 8:30. And from 8:30 to 9:30, we have the international session in English. And from 9:30 to 10:30, the language session in we are uploading the videos of the same on IFPH YouTube channel. And you can subscribe the same without paying any money, and you can share it with your friends, both homeopathic doctors, students, as well as homeopathic lovers too. The purpose of this forum is to take homeopathy to each and every household of um, around the world. And let me come to today's guest. As you all are quite familiar with Dr. AAMIR NAZEER Malik. He is from Pakistan and is an ardent believer of homeopathy and a person who is trying his level best to take homeopathy to everywhere with the scientific explanation to all. And he has completed BSc in chemistry, MSc, and then DHMS, RHMP, and he is the chief physician at Malik Homeo Heritage Clinic, MHHC. And he has more than 27 years of experience and is an ambassador of health and humanity, Hyderabad, UK, and is a member Supreme Council, Hyderabad, UK, and is obvious member, cabinet member, and he is the coordinator from Pakistan is at the AFBH webinar and is doing a wonderful job, BLS in University UK, American Heart Association, USA, and MS scholarship from Mountain William, USA, and National Panel, ISD, NACE member, National Academy of Young Scientists member, and his MSc Biochemistry, all derived BSc from Chemistry, Government Open College, and DHMS from and RHMP from Punjab University. And today, Dr. will be discussing about nephrotic syndrome and resistant DELTACORTIL. So let us proudly welcome Dr. AAMIR Malik, and we welcome all the participants from different parts of the world to this session. Welcome all.
Namaskaram, greetings, honorable sir, honorable members. God bless you, everyone. I hope everyone is fine and doing good. Today, our session is about the nephrotic syndrome. This is the first time I have received this kind of case. I don't know, sometimes we got very chronic cases, sometimes acute cases. So it's our life. The life of doctor is full of all these things. So when I see just 1.5-year-old girl, she is suffering from nephrotic syndrome and have got the symptoms. The reports, Honorable Dr. Danish, can you share the slide, please? I have sent you the reports. I will send you again. Please just give me 1 minute.
Sorry, sir, I was not here, so I couldn't.
Okay, I'm sending you. Just give me 1 minute.
Sir, I'm not in a position to share today. As we can.
Okay, I will share with Honorable Sir Abdul Salam.
Yes, yes.
It's easy for you, sir.
Please find another one, Dr. AAMIR.
Okay. Okay, Honorable Sir, I'm sending.
I don't know. I stop it.
Okay, sir, I have sent it. Please see the pics of this girl. She is the edema is too much on eyes during the sleep. Even she is when awakening, the face is full of edema. There is no edema on the legs and abdomen. This is luckiest thing. And the protein in the urine is +3, and albumin in the urine is +3. Now, in nephrotic syndrome, first of all, we should understand this thing, that what is nephrotic syndrome and why it's syndrome. Syndrome is a word, I believe, when the Western medicine, they have to close a chapter of disease. They use this word, syndrome, just for this thing. This is an escape, a big escape from the reality that the organ of the human can be repairable. It can be recovered very well. But they close with this comments that it is a syndrome. Syndrome means there is no solution. There is no medical solution for the organ or that disease. So by blessing of God, homeopathic have this potential that those cases which cannot be controlled and healed by sometimes even by the medicines and steroids, that can very easily handled, well controlled and well treated with the help of homeopathic medicines. Now this baby, that baby girl, she is only 1.5 years old, and since 6 months she is on Western treatment, and they get assured, the parents assured, that there is no treatment for the nephrotic syndrome. So someone guide them. There is a solution in homeopathy. You may go there and just search. They searched me from somewhere and they visited my clinic with the issues. That time I have seen the baby girl. Now, Honorable Sir Abdul Salam, may you sir please share the pics of that girl, baby girl. See how much edema on her face, and she is taking very little mother fluid. The very important point. First, I would like to explain you nephrotic syndrome. What is that? You know, there is a filter house in the kidney. The main filter house through the electrolytes and blood purified and back to the body. That place which filtered the blood is very important. That is known as glomerulus, the main filter house of the kidney. The pics. Okay, I will continue. When I have seen the situation of that baby girl, I was just shocked because they said that she is not only suffering from nephrotic syndrome, she is also resistant to deltacortil. There is a one treatment in Western type of medical system that if the urine, the albumin and the protein is passing through the urine, they reverse this process with the help of deltacortil. Deltacortil is the steroid which is widely using in the Western system of medicine. So what happened that the urine properly created by the kidney and be excreted properly. If when they start the deltacortil treatment, unfortunately, that baby girl is suffering from a big issue that she is resistant to deltacortil. Now they are very much upset that what they have to do. They have tried a lot of different treatments but cannot handle the situation of that baby girl. Look, see the face of that baby girl. Pics comes, please see. She looks like the Chinese, you know. With apologies with the Chinese. She looks like the face of the Chinese people. See how much edema on the face. So, nephrotic syndrome, the glomerulus, that is the part of the kidney which filter the electrolytes and back in the blood. Unfortunately, when there is a sclerosis or vessels damage, clusters of vessels are damaged, the glomerulus unable to work. And I was surprised that there is a sclerosis of glomerulus also in the kidney. So for us, for the homeopathic doctors, sclerosis is never be an issue. Never be an issue. It is very easy to handle because multisclerosis MS is well defined and well treated in the homeopathic, especially in the autistic children. They are mostly 80-70% they are suffering from sclerosis issues. So they said the protein is +3, the albumin is +3. The reports are there. I have sent it, Honorable Sir Abdul Salam. I have sent the reports. You can also share. You can see the level of protein and albumin is +3. So they said for more than 1 year, that baby is on different kind of treatments. Now just see the face. This is during she is on Western medicine system. The edema is uncontrollable. Simple is that the urine she is also not passing properly, just hardly in 2 or 3 times a day, a very little bit quantity of urine. And they are very much unsatisfied and worried about what to do for their daughter. When I've taken the case, I have started this that she is, main thing is that the protein is there, the albumin is there. This pic when I just started the medicine, and after 2 weeks, you may see what is the incredible results that the edema totally disappeared, and urine starts flow properly. The quantity of urine is very in plenty, and the edema totally disappeared on the upper eyelids and the face, and the albumin becomes +2, and also the protein. First, I have given Berberis vulgaris medicine. I told them just in 3 days, let me show the progress on regular basis. What is my way of treating the patient? That just in the 6 hours, 8 hours basis, I requested the parents that send me the face pics. I just want to totally monitor the edema on face. If it get reduces, it will be very much excellent. So if there is no improvement, so I can also judge at my earliest, so I can take action and have to change the medicine. So just in 3 days, unfortunately, there is no result. The result is totally zero. So edema is in the same way. First medicine after Berberis, second medicine comes in my mind is arsenic album. So because the biggest, it is very important. The antidote of deltacortil is arsenic album. Even all different kind of steroids, the best antidote is arsenic album. It excellently clear the pathway here. But the point is this: she is resistant to deltacortil, means steroid cannot be do the work in the body. So immediately, second call is for the arsenic, and I have given in 6C and 30, but there is no result within 3 days. So it becomes 6 days. So I just worried why the urine is not improving, why the edema is not reducing. So what should I do? So I go for this point. This is also a blessing, the homeopathic medicines, that the center of kidney, the glomerulus, the center of kidney, if it's not working properly, where should I go? What medicine should I give that that portion, glomerulus, start working? So that time I immediately clicked a medicine terpentina, and plus very important, I will show you the final name of that medicine, which works. First, I would like to send pics that what is the miracle comes after that medicine. Please give 1 minute to share me the pics. These pics are after just 2 weeks, sir. You can see there is the edema is 80% reduced during sleep. During sleep, it's 0%. There is no edema on the upper eyelids. Yeah, the pics I have sent it. Please, Honorable Sir of Islam, may sir, please you share the pics of the girl, baby girl. When I gave the terpentina, the urine flow little bit increases, about 20%. Then I have a final thought that if the center of the kidney, even this medicine is same for the dialysis patient. It's very important. In the dialysis, when the kidney is not function properly, when the creatinine is high, the wastage of the body is high in the blood, urea is high, uric acid is high, creatinine is high, protein is +3, albumin is +3. The next stage is very critical, because then in the next stage the protein passes from the stool also. So this is a very worst stage when patient survival is impossible. So I just give the medicine Merck core. in very low potency, 6. And caliclor, 6. Please save these medicines. You can just see there is no, after giving these medicines, the urine flow is very plenty, very frequent. Albumin is +2, the protein is +2, and you can see there is no odor. This is a successful result of these two medicines because the center of my kidney start works. This is very incredible. Maracor have the ability, and the potassium chlor. Potassium chlor is very important medicine in homeopathy. It helps to rework that dead portion, the glomerulus, which is not working. This is even not the medicine of sclerosis. This is very important. I'm telling you, sclerosis cannot be handled by these medicines. But fortunately, because the medicines are polycrest, they also give this result that the center of kidney, glomerulus, the filter house of the kidney. Two major things when the kidney failure. One is the failure of the Bowman capsule and glomerulus, where the urine blood cannot be filtered. And second, the failure of the membranes is known as the kidney failure. CRF, ARF, acute renal failure, chronic renal failure. What is that failure? Bilateral parenchymal disease. What is that failure? In biparenchymal disease, the kidneys get enlarged. Arsenic works very well. But when the filter house is not working, protein is high and albumin is high, you have to treat the glomerulus. I would love to say this, that if we specify our drugs, our medicines, they have individually incredible results for the diseases. On just name of disease dialysis, the failure of the kidney, CRF, you can go for these medicines also. Because Maracor and potassium chlor, potassium has a very big role in our kidneys and in the whole body. So potassium chlor is a very also diuretic medicine, and it helps to restore the function of the center of the kidney. So what happened? Just in 2 weeks, after that 1 week and 3 days, and the second 3 days, and the next for 2 days for turbanthina, I switched the case on these two medicines. And the parents, I am very much happy that they are very much relaxed. They are surprised. They have no belief that the homeopathic medicines can work miraculously in this way. So then they asked me that why there is no articles and ads and something like in from the homeopaths that you can treat these kind of medicines. I said we are doing this, but the problem is the problem of belief. The peoples, when they go hospitals, they have mind, they have a decision barrier that they have to follow the Westerns. But homeopathic can do this help. I think so. We should have the meetings with the Western doctors also, that you don't have any kind of medicine which can help in this way. That baby girl, which is deltacortil resistant and is not treating by any kind of medicines in the Western, she is very well treated within 3 weeks. And now she is on our medicine and she is fine. That's great. So second, yes, I would like to share one more thing. What is the normal protein level in your blood and body? That is 150 milligram per day. So if it is more than that, it means your kidney is not functioning properly. The weight gain is there, the edema is there, the face eyes, the urine is foaming, and face eyes swelled. So this is how the medicines work and clear the pathway. Second, now I want to discuss one more case. That is the case of gangrene. The nephrotic syndrome case is finished, and I've told you about that. The second case I would like to share the pics. A patient is 70 years old. His father is suffering from gangrene of the right leg, and there is a sclerosis. The color Doppler shows the 20% flow of blood in the lower limbs, and few part of the leg is amputated. And they said now there is no blood circulation, so we have to completely amputate the leg from knee to from toe to knee. So I am sharing the pics. First, you may see the pics of a dead leg. It's a dead leg. Honorable Sir Abdul Salam, please kindly share these pics. I am sending you.
Okay, noted game.
Yes, I'm sending, sir.
Okay.
Now, dear Honorable Sir, I have sent the pics of that patient,
Okay.
70 years old.
Okay, wait, let me check.
Yeah.
Submit.
Yeah. Right leg is amputated, and the flow of blood is dead in that leg. This is also a kind of sclerosis due to high sugar, and the flow of blood just dead in the lower limbs. So in the Western, there is no option that they have to amputate the leg. And I have sent you the pics after treatment. That is surprising. The blood flows just like a fresh lamb. We cut it, and the blood oozes. It's just look like that. So amazingly. And this miracle happened in 27 days. They have no belief. The family, whole family, some in Bahrain, some in Canada, some people's family members are in America, and they said we have 0% belief that this leg can be recover or had not go for the amputation. So they've decided that we will wait for 5 weeks, because one of very good family member, he took the homeopathic medicine treatment, and he is very much satisfied. And he said, you just have a wait for few days, and you can see the miracle of homeopathic medicines. It can be recovered. Even their surgeons, their doctors from abroad, they told them there is no cure for that. That is impossible, that the blood can be flow in the dead leg. That is not possible. You may just see they make a panel of 25%, 25%, and on daily basis, when they monitor the leg, how much it recovers, you can just see how the fresh blood is oozes from this. Another pics I have sent it, Honorable Sir, Dr. Islam. I have sent the pics, sir. After 3 weeks, the blood started flow plentifully in the legs. The flow is very much high, very much rich. I will also share the blood reports.
This one, no, this one.
Okay, I'm sharing the blood report. The color Doppler. A very important thing is color Doppler. That how homeopathic medicines can do miracle in the dead leg. Either the gangrene is wet or dry. For both, our medicines work very well. This is the wet gangrene, and that patient having sugar also. Age is 70 years. The hope of recovery is very less. When the patient is 70 years, the hope is very less. So I have shared one of our ad that the peoples are quitting surgeons and they're moving towards homeopathy. I said how the homeopathic medicines can work deeply, because people consider we have sweet tablets, so we cannot do big. But this is wrong. The pharmaceutical basis of homeopathic medicines are just known as the nuclear fission. We have not a normal kind of medicine. The preparation of our medicine is just before the Louis Pasteur and Alexander Fleming, just like the base of vaccine. But when the titration process increases high towards high potency, The potentization is 100% followed by the nuclear fusion process. So when we go towards 10 m and cm, it means after that titration, the reaction of medicine is so deep. The pharmaceutical bases are very important in homeopathy. There is no guidance properly on it, that how many doses should we give, how much time we have to repeat it. So when people go for this, they get confused. Some people believe to go in 30 potency, we should move, and then we wait and see the results. But what to do if we have on urgent basis we have to treat? It looks very difficult. So at that time, regarding our treatment of our medicines mode of action, we can go to high potency and we can give instant result, SOS results. There is SOS treatment. Also in homeopathy, we can treat the highest sugar level in low time, lung saturation in low time, just because the action of our mode of action of our medicines. This is at the color Doppler and the prescription from the doctor. And when the blood reflows, they ask me how it happens, sir. What is that? So I told them we can treat cancer very well. There is some ingredient is very important. When we said homeopathic medicine, I give aurum metallicum to that patient. Would you believe? Just aurum metallicum. And aurum metallicum give for 3 weeks, but how many doses? And what is the potency? Potency is CM, 18 doses in a day. 18 doses in a day. And just in 3 weeks, the blood start flowing very well in the lower limbs, both lower limbs. Second leg is also weak, the flow is very low. So what happened in future that they have to amputate one leg, and after that 6 months they have to amputate second leg. Mostly happen in the gangrene patients. So a very important point, we have to monitor the sugar regularly. If sugar is not maintained, the result cannot be triggered. Reason is this: high sugar always causing the obstruction and cannot be work well. Our medicines cannot work well. So they are properly giving the medicines of sugar. It's also homeopathy. I love to give Gymna sylvestra. It's a very famous medicine and having a great result. You know, if we have taken sugar in mouth and just put this herb in natural raw form, our mouth becomes sore because they immediately absorb the excessive carbohydrates. It's a very excellent remedy. There are a lot of medicines because every doctor having his own experience, but you may can try also. I have give the mother tincture and also the high potency CM Gymna sylvestra, and it works very well. So so people ask about the that what is second thing which can recover that disease. So it is your oxidation level within the blood. If you want to increase oxidation, the process of healing you want to boost, you can go for the medicine which increases the oxygen level. And there is our medicine vanadium. Vanadium is a metal, and it boosted the oxygen level within your blood. So the sugar patient blood is not purified. It's the viscosity of the blood is high. So sometimes if you found that the result is not going good, the blood circulation is not improving, you can also give the vanadium. Vanadium works very well. So this is how the patient just recover in 3 weeks. 3 weeks, you know, it's a miracle. 27 days. And how they get know, when the dresser, the male nurse, he come regularly to dressing the leg. So he found the blood is oozes from the leg. So he was just surprised and shocked that it is healing successfully. Then they go for the color doctor and it's okay. Because either they don't go for that, the blood is flowing, which shows The blood is regular now. So I've shared these two cases. If you want to ask any question, please you may again ask. Because the time is 15 minutes are there. You can ask the questions.
Yes, it's the time for discussion, and those who want to participate in the discussion may kindly come forward with your questions. And definitely, Dr. Amir Malik has presented a beautiful case and a remarkable, uh, unbelievable case for that presentation. Choosing such a wonderful case in this evening is really we salute you, sir. It's a big salute to you, sir.
Thank you very much, sir. Thank you very much. So it's not our miracle, it's a miracle of our honorable founder of Homeopath, Dr. Frederick Samuel Hahnemann, our Holy Father, who gave us the very biggest treatment, who guide us the medicines. I believe homeopathic is totally biochemistry. If you go for the any ingredient in the Western medicine, you can find also same in the homeopathy. And if you as the in the neuropathic pains and diabetes and the trauma, they widely using dopamine and serotonin for chronic nervous disorders. And this is all available in homeopathy. The pituitary medicine give boosted the same hormones, the exciting hormones, the happy hormones, the love hormones. They boosted. Sir, I believe also we should guide the patients and the pupils that how homeopathic also can help in the same way. Because when there is a patient of COVID, their saturation is 60%. So I have sent medicines to have in the inhaler. That lady was surprised. She said, "You have these kind of medicines?" I said, "Yes, we have it." And you can see, just wait for some time. Give me 15 minutes. The saturation in the lungs can be improved. So she was shocked, that lady doctor. She called me specially that you send these medicines to give in the inhaler. I said, yes, we have these kind of medicines. We have the injections. Unfortunately, the people are not guided much. This is very wrong. Western don't believe we have medicines. Their
That
subcutaneous medicines are available.
that means you give much importance to diagnosis of the patient and the
Yes, sir.
choosing a treatment in accordance with the diagnosis.
I believe, Mr. Now just see nephrotic syndrome. What is the medicine? Potassium chlore and the Maracor. They restore the function of the kidney. This is very much amazing, sir. When they put the patient on dialysis, it doesn't mean the patient getting the treatment. It means it is only sporting, because whatever the patient eats, just after 2 days, gets out from dialysis. The patient day by day becomes weak, and the final is only 5 years to 6 years dialysis patients. Why? They died due to poor nutrition, and they become very weak and pale. They cannot go for any physical effort and working, and even same for the sexual. There is dead activity. But in the homeopathy, you can restore the kidneys. And biparenchymal disease is the enlargement of kidneys and dysfunction. So we should give arsenic and high potency. I found a patient of dialysis who is having 3 dialysis in a week. And when he visited to me, I asked, "Have you any urine in the day?" He said, "No, I have not 0.1 ml urine in the day." So, okay, I said, "Just please don't stop my medicine. Continue." I just give the arsenic. And believe me, after 4 months,
Potency.
after 4 months,
Arsenic is potency.
yeah,
Potency.
arsenic, I have started in 6C. Then I have go on to CM. The final, when I, after 4 months, the potency of arsenic is CM, 6 to 12 dose in the whole day. And after 4 months, the first urine which he passes is just 1 tablespoon. And he is very happy, just starting jumping. And then I've continued the medicine. He just died after 9 months due to the wrong injection in the hospital. They give the injection of painkiller, and it was not properly in the abdomen somewhere. They injected, and that patient died due to that injection which was given in the wrong direction. So the urine comes start flow normal just with the help of arsenic. So I believe that we all homeopaths should be confident for our medicines working, and we should consider our mode of working of our individually, which medicine can what they can do. This is very important.
Exactly. Your confidence in the medicine really give the result, and the patient and have a
Yes,
that they should continue the other system also. That may be the reason why such thing happen.
yes,
Unless
sir. In cancer, yeah, I would like to share one more thing. Today's there is a metastatic cancer. Metastatic cancer means there is no reason and the cancer is there. Means patient comes, he is not drinking alcohol, he is not having tobacco, he is not having smoking. And what is the cancer he is suffering from? Colon cancer. So I have taken the history. It is metastatus, and from colon to it spread towards liver. And they have two courses of chemo. And then when he visited to me, I just asked one thing. After the first chemo, he recovers 100%. So I asked only one question: if you recover 100%, why you are going for the second chemo? He said, doctor told me. So I read it with the red pen. I said, ask your doctor why you are giving me the second course of the radiations when I get recovered from the first. So they have no reply. He just died in 3 days because the second dose is unwanted. I believe now our food, our fruits, our vegetables, all is causing the cancers. They have a spray, growth hormone spray on the crops, on the rice, on the wheat, and the 6 months crop will be received in 2 months because it's boosted the process. The size of the fruits are enlarged. The carbon is too much in air. The seed is from China. It was recultivated because recultivated means in the past farmer have no idea if he sow 10 seeds how much will be give him back the result. But after that China seed, it is 100 by 100, means you sow the 10 seeds, it will be 10 will be okay by 10. So the nutrition is very low. So our cows are sick, they are giving oxytocin. The reason is that the cow gives 30 liters milk, otherwise it gives only 10 liters. All these food factors, all the crop factors are causing too much cancer, too much diseases, enlargement of kidneys. You can see just 23, 26 years old children's, girls and boys, they are suffering from heart, they are heart patient, they are suffering from kidney failure, they are suffering from diabetes. Why? In the past, you can see how the peoples are healthy. The second disaster is in the Western medicine. They are going to third generation antibiotics and steroids. In the 20 years back, there is first generation of antibiotic. Now you can see the newborn children's. They are taking third generation antibiotic, and after that, the immunity is dead, and then they are on the steroids. This is the back hack of all the latest world. This world is only giving destruction. In the past, there is a peace, there is a good health, good wealth, everything is good, but not now.
so unfortunately, people are not aware of all. Even we people are not aware of, we're not thinking in that line. So we will have
Yes,
to make sure we will have to motivate the people to eat fresh things that are grown in the natural way rather than that are artificial made of artificial way. Am I right?
yes, yes, absolutely, sir.
If any,
So the homeopathic,
if anyone want
our
to Dr. Amir Malik, if anyone want to
yes, sir.
talk to Dr. Amir Malik, please raise your hand. I am inviting Dr. Ambadi, Ramadevi Ambadi Madam to say a few words on this presentation as well as some
Okay,
input
okay,
into the session. Dr.
okay.
Ambadi Madam. Please. Yeah. Dr. Nasilia, do you want to talk to Dr. Amir? You want to have a question? Dr. Ambadi, madam, are you there? If you are there, please unmute yourself and I invite Dr. Ramraj. Dr. Ramraj, sir, please unmute yourself. Please unmute once again. Yes.
Thank you, Dr. Dhanesh ji. And
धन्यवाद honorable sir, धन्यवाद.
Dr. Amir Malik,
Yes sir.
gangrene case is a very good case presentation and nephrotic
Yes, sir.
syndrome case. Very good presentation. And namaskar, Dr. Abdul Salam ji.
Namaskaram sir, namaskaram. Greetings sir.
Namaskar.
Love you sir.
Very
India
thanks.
loves in my heart. India lives in my heart, sir.
Yes,
With Shri Amitabh ji. Love you, all of you, sir. With lot of love.
Okay, sir.
Lot of
Okay,
love.
thank you. Thank you.
Thank you, sir. Thank you.
Thank you.
Dr. Amir, what's your experience lumbar met in managing kidney diseases?
Sir, please repeat it.
What's your experience with the lumbar met and
Plumbum. Sir, I found plumbum, my personal observation. Plumbum is a very good medicine for the paralysis. Especially, in our Materia Medica, it's written for the paralysis of the pianist and the musicians, where they work with the short organs, means the fingers, the things which we will not use majorly, but on the minor level use very much because the usage is very high. But second, for sclerosis, plumbum is a very good medicine, sir. Plumbum is because, sir, I would just want to share one case which will be surprise you. One person visited my clinic that he is having a lot of a big tumor on his heart. The size of that tumor is around about 600 grams. It is very big. So when I've taken the history, I just asked what happened. He said, I'm giving a badge to my students, and I have a badge to put here on my shirt. The pin of that badge is full of rust. It's totally full of rust. And when he just put to have that badge on his shirt, it deeply damage and insert in the skin. So then he just put out that pin and apply some little bit alcohol on it. After few weeks, there will become a cyst on that area where the rust pin was inserted. Now this is very amazingly, I'm sharing a case which have a symptoms is very different. The tumor become on daily basis it growing, or on regular basis it's growing and becoming large. The pain is there, and he said, I have taken a lot of medicines, but the size and the growth is not controlling, and it will causes a lot of stress on my heart. This is the miraculous approach of homeopathic medicines. Sir, what medicine I give to that patient? I doesn't give him any medicine to reduce the tumor. My mind just clicked that he is having the iron toxic, as we are on daily basis. When we are doing hoteling, they cook the food in the aluminum. The pots they use, they are made of aluminum, and aluminum is the very biggest toxic. The metal toxics is also there in the world, which is destroying the humans, and the carbon toxic, which is causing too much cancer, metastatic cancer. So I just give Lidum. Would you believe? It's the best medicine for the iron toxic. In 6 months, there is 0.0 millimeter size of tumor on his heart. Just Lidum reduce the tumor. Now we have never found this statement in our materia medica, that the lidum can be reduced to the tumors and the iron toxic. So this is also an amazing approach. That is also an amazing approach, because I know the homeopathic works from anywhere, anywhere to any disease. This is the amazing quality after the titration process that this happened. But homeopathic can help the humans and humanity, that if they have iron toxic, they can consult us. We can help them. If they have aluminum toxic, we can help them. If there is plumbum toxic, we can help them. So these, the metallurgy, the metals toxic, we can handle this very well. Nowadays, sir, our main problem is causing by the food, by the animals, by the milk, by the vegetables, by the fruits. And unfortunately, the very important thing is the superfoods, which can recover us, give us a good health, which can prevent the diseases. That is disappearing by the mafias. They are not allowing to enter those kind of foods or superfoods which can cure the human. Actually, main fight is in the Western and homeopathic is about the word cure, because the Western does not claim for the cure; it always claim for the treatment and treated, steroid and surgery, painkiller and surgery, antibiotic and surgery. But the homeopathic claim is this, that we can cure. This word does not exist in the dictionary of Western. It's only exists in homeo. And this is the reason we are working for something which is not the Western. But the mafia is in the hand of Westerns. What they are doing, they are just crushing and screwing us by the wrong objections that we don't have scientific evidence. We have all scientific evidence. The simple evidence is more than enough that potassium cyanide, the world strongest venom, is our medicine. This is a very much big evidence. Second evidence, we have the radioactive isotopes. Radioactive isotopes are our medicines. They are giving chemo after the first chemo. After second chemo, 90% people will die. But the oncology department is not highlighting that what chemo is doing to the humans. You just see the death result in UK. Just see the death results. People are dying after chemo, and what they are claiming, they said, we believe we are okay, but when they start our chemo, we become worst. And believe me, there is no person who is not, you can say, teased or become in a big problem after consulting the oncology department in abroad. Now there is a group of doctors which is working to control the cancer with the help of superfoods. And you know, they are from Western, and they're not showing to their own community, because if they show this, they will be fired.
Okay.
In our country, same happened.
Yes, sir. There's a question from Dr. Irfan Ahmad. Dr. Irfan, you can directly ask the question. In nephritis, Epis mellificus, why not? Please,
Why not Epis mellifica? Okay. I will reply. I just read the question. In nephritis, Epis mellifica, why not? Sure, honorable doctor. It doesn't mean that we can't go for the Epis, but I'm telling you, just go for the.
Dr. Amir,
Just go for.
Can you adjust your camera a little more? We can see only.
Achha. Okay, sir. Okay. My camera is okay now?
Okay. No, okay.
Okay, now I'm replying, sir. Remember key function of the drug. That is very important, sir. How are you, sir, Irfan? Key function is very important. Apis mellifica, first of all, you must know what is Apis mellifica. It is a venom of honeybee. It is the venom of honeybee. You know, 25 ingredients in the honeybee. You know? Okay, now come to that point. The center of kidney, I'm telling you, center of kidney, glomerulus. Apis have not this ability to work on the glomerulus. It works very well. It can, you know, the first appearances of that baby is of Apis mellifica. This is why I know you approach this, because the facial appearance.
edema,
But
yeah.
the problem is that when you
Mm.
have the steroidal resistance, no medicine on acute level will work. Their EPIs have very good results. You know, you can't believe there is a treatment of multisclerosis, muscular dystrophy, multisclerosis, muscular dystrophy. I'm telling you, it was announced in 2004, the Doctors Hospital in USA, Washington, DC. They have treated a woman who was neglected by the doctors that you will be no more. She is suffering from muscular dystrophy. Accidentally, she was stung by the honeybees and she become normal. After 6 months, he visited Washington, DC Doctors Hospital. That time, the government of USA, they announced that the people voluntarily go for the bee venom vaccine. And subcutaneously, it was injected on the government level of USA. Government said, we are not responsible. You can go at your own for voluntarily, you can go for this vaccination. And in just 6 months, arthritis, high blood pressure, diabetes, and all other diseases are recovered by the bee venom. You can find this documentary on Discovery. It was happened in 2004, USA, Washington, DC Doctors Hospital. That time I was really screwing myself. I said, why the homeopath does not get up and talk on this, that we have that medicine which can cure the muscular dystrophy. And the doctor comes who said, I told for the mercy death to this woman. Mercy death, you know, it was too much in the abroad when the patient cannot bear. Even in my country, I have found one cancer patient who himself said, please give me that injection. I cannot bear. I want to be die. And they give it in Hamid Latif Hospital, Lahore. This is in front of my eye. I have found this. So I'm telling you, we have a very big medicines, but we have to control media. We have to control media. But in syndrome, nephrotic syndrome, I am telling you, APIS cannot work. Its level of working is acute. When you purely go for the kidney function, no nephrologist can approach this kind of medicines. This is their bad luck, and we have the good luck that we have these kind of medicines. I'm telling you. So you can personally nephrotic syndrome, because we follow repertory. I'd never follow repertory. I just want to know the disease pathology. What is that? If I can understand, then I work. You know, there is 125 of arthritis, 125 types of arthritis. Homeopathic is dealing, Apis mellifica is dealing with 120 types of arthritis. This is the miraculous healing of Apis. And in the Western, they go for one HCQ inhibitor. This is the only solution they have for the arthritis. But
Yes,
we have
sir.
Apis mellifica. Just one medicine, one man army is Apis, one man army. It's Apis.
Great, sir. Thanks.
Welcome, sir. Welcome.
Yes,
Welcome.
yes, that's what Dr. AAMIR Malik is all about. He can talk to any question, and he can answer to any question because he has so much exposure to all this field. And his knowledge in chemistry as well as biochemistry really help him to go in and find solutions to each and every case. And that's why he was asking why come us to make this benefits especially for these things. So it's the time to end the session.
Thanks, sir. Thanks.
I invite him, Dr.
Thank you. Welcome.
Irfan Ahmed to
Honorable
say
sir, welcome.
thanks to the session. Yes, Dr. Irfan, you can say what
Yeah, sir. Your question?
You can say what thanks to the session.
But
So there is a question from Dr. T.N. Siridhara. If I'm talking wrong, please forgive me.
No, you're
I love
right,
to
sir.
speak your names when I've seen your shows. I love to speak with Shahrukh, with Shri Amitabh. It's really great movement.
That our time is already over, sir. That's why this is the time for another
Thanks.
gate host is waiting. Okay. Anyway, congratulations, Dr. Amir Malik, and those who participated. We are very happy
Thank you
to
very much, sir. Thank you very much,
thank,
sir.
and particularly Sri Abdul Salam sir, who has done a wonderful job of sharing the subject also here.
Miracle. Yeah. Thanks, sir. Thank you.
Thank you
Oh.
once all the participants as well as our Dr. Amir Malik. Thank you all. Tomorrow we will have a session from Dr. Harish Kumar. He will be talking about his clinical experience. All of you can join by using the same link that we used today, and the video of the same will be uploaded tomorrow by evening. So you can search at IFPH Homeopathy for the same.